One of the procedures that we perform in all of our surgery centers is called Vertiflex Superion. Vertiflex Superion is a highly effective procedure which is indicated for patients who are above 50 years of age and who are suffering from mild to moderate spinal stenosis. How do we know they are suffering from mild to moderate spinal stenosis? Number one, by examination, by their symptoms. So if they are suffering from low back pain with pain radiating down their legs, and when they're bending forward, like leaning against the shopping cart, they start feeling better. And when they're straightening up, they start hurting and they have a claudication or radiation of pain and numbness going down the legs or buttocks. So Vertiflex Superior is a device which is almost a shape of a butterfly, and it goes between your spinous processes. So the spinous process are small spikes that you see that's coming out of your lower back when you touch your back. So those are called spinous process. And we place under a minimally invasive procedure, make a small incision on the patient's lower back after we determine which level is actually causing spinal stenosis. Let's say if it's L3-4, L4-5, or L2-3, and we just pick one level at a time which we think is responsible for patient symptoms. We make a small incision under fluoroscopy or X-ray guidance, and then insert that device between the spinous process. And that device basically keeps the spinal column and neural foramen and spinal canal patent so that the nerves and spinal cords are not getting clumped in that narrow space. And the patient gets amazing outcome and results. And the good thing about this procedure is that it's minimally invasive. There's no major incisions or surgery involved. Outpatient procedure, patient can be discharged the same day. And then the patients are followed up with the protocol of physical therapy for a few weeks. And they just get 80 to 90% resolution of their symptoms. And this procedure has about 80% plus success rate. This procedure takes usually about 20 minutes, 20 to 30 minutes. Recovery in the recovery room is usually standard, like 15 to 20 minutes after the procedure. Once the patients are discharged, then they are given a protocol for 4 to 6 weeks in terms of what are the things they can and cannot do. So they have to be careful in the first week when they're recovering. And then second week, we refer them for a physical therapy, gentle range of motion type modalities. And then we gradually increase the intensity of physical therapy after over 4 to 6 weeks. And by 6 weeks, they are pretty much normal.